Welcome to Grade 1 View, the podcast for future CRNAs by future CRNAs, a partnership between AANA and Beyond the Mask.
Whether you're about to graduate from a nurse anesthesia program, trying to get accepted to nursing school, or you're somewhere in between.
This podcast is a resource and safe space for all things nurse anesthesia.
We're your Season 2 host team. I'm Levi Davis.
I'm Kelsey Muir.
I'm Mackenzie Lane.
And I'm Nicholas Alexander. So grab your Mac or your Miller, turn up your flows, and get ready, because this is Grade 1 View.
Welcome back to Grade 1 View. I'm Kelsey Muir, and in tonight's episode, I'll be interviewing my co-hosts, Mackenzie and Levi, who attended Lobby Day with the Florida Association of Nurse Anesthesiology, along with Nicholas, who participated in Capitol Day with the Arizona Association of Nurse Anesthesiology. So these advocacy events give SRNAs and CRNAs the opportunity to kind of step outside the classroom, as well as the operating room, and kind of into the halls of government, and meet with legislators, share their stories, and advocate for issues that directly impact anesthesia practice. So today we're going to kind of walk through the prep that they did, the meetings, the nerves, the triumphs, and why showing up to advocate isn't just important for policy, but also important for every SRNA's professional journey. So welcome, everyone.
Hi.
Hey.
Hello.
Thank you.
Hey, guys. Thanks for joining me today. So kind of to get things started, I guess, for those who are listening, who are not really familiar with what Lobby Day is or Capitol Day, if you could just kind of explain what it is and why it matters for SRNAs specifically. Levi, you want to start us off?
Sure, yeah. Lobby Day is a great time. I'll start off with that. It was a really good time, but it's very important to lobby for your profession. This is your career. This is your future income. This is your future well-being and well-being for your patients and what's best for them. And you're at your capital in your state lobbying with the House of Representatives, and the Senate. You're with your senators. You're meeting with these people in their offices or with their staff members. And you're talking about what is important for your patients and your career and healthcare professionals statewide, but it also ripples the effects to the national level as well.
Nice. Yeah, Mackenzie, what are your thoughts? Why did you decide to join this?
Yeah, one thing going into it, I was like, are we going to be arguing with people all day? What does this look like? And I realized that advocacy is not arguing with your legislators. But what I did learn is that it's about educating lawmakers on what CRNAs actually do on a day-to-day, correcting their misconceptions. In a lot of ways, the best way to do that, I learned, is through sharing patient-centered stories with them. Those have a really good effect, and people tend to remember those things. So that was really, really neat. And I think that while I was there, I just came to this realization as I heard some misconceptions and some kind of like maybe the other side. I realized that if we as CRNAs and residents, if we're not sharing our story and advocating for our profession, somebody else is going to fill that gap, and it might not be accurate information.
Yeah, that's a really good point, actually. Nicholas, what about you?
I think it was so much fun. This was my first time going to Capitol Day, and it was so cool to see just registered nurses, the SRNAs and CRNAs showing up and just advocating for the profession. I think it's important for the legislators to actually see their constituents and the people that they represent. Because as Mackenzie said, they listen to those stories that sticks with them more. Our goal is to educate them and show them what we do. And what's cool is even here in Arizona, some of our CRNAs will actually take some of these legislators to the OR and actually show them, give them that actual experience so they really see what we're doing.
Man, I should have done that with my representative and my senator, because I was a constituent in both of my meetings that I had with my people. I should have offered that. I would have to definitely get the authority to do that, but that would be a good idea for them to see the day-to-day of what a CRNA does.
Honestly, I think it makes a huge difference. And sometimes it's hard because you're kind of going in there with people that you are on different views with politically, but you just want to advocate for the profession and kind of just keep it away from party filaments. You're there just informing them of patient access and the increase to healthcare within the region that they are representing.
Yeah. I went to actually mid-year last year, and I that was really powerful for me. And Mackenzie, kind of to your point, sharing those individualized stories, I think really kind of sticks with those people after you've left that meeting. But it's like also you're just trying to make an impact in such a short span of time, so you feel like, okay, I really have to capitalize on this conversation. And so, how are you going to draw somebody in and get someone to care in such a brief period of time? So I feel like, those individualized stories really make a big difference. But that actually kind of leads me kind of to my next point in terms of like preparation. So I don't know if either of your state's organizations kind of had mentorship programs or any talking points, training sessions. Can you kind of like, how did you guys really truthfully kind of like prepare for the day? And were you provided with, some of that education beforehand?
A little bit, yeah. For me, the main thing was showing up and looking good, you know?
Oh, easy to
Uh,
do, Nicholas. Easy to do for you.
Yes, yes.
Especially with that shirt you're wearing tonight, by the
Yeah,
way.
for
Oh,
everyone, he
yeah.
has on a shirt with the different Malampati views.
Yeah. But beyond looking good, obviously, is what the ASANA did is they sent out just talking points from AANA about just like the benefits of CRNAs and just information that if it's brought up that we're able to speak to. Because again, we are SRNAs, we're still learning. We're not going to have the same experience as CRNAs. We just had some like brochures that we kind of handed out to legislators, but we also use those same things to kind of read up on before we went down there.
Very nice.
Nice. Florida they prepare us huge. CRNA days is actually like kind of like a day and a half. So you actually get up there. We got up there on a Wednesday evening and there was like a little bit of a cocktail hour where you got to have a drink and then have some food. That's where I actually met Mackenzie in person for the first time. It was fun.
So fun.
Yes. And there was so many students and faculty members from around the state that you can see. And I'm actually my school's representative for FARNA. So there's FANA, and then there's FARNA, which is the resident association, and they actually hold a chair on FANA's board. And so we get fed the information through FARNA's president, and they're constantly sending us updates at the legislative level, but they're also sending us FANA updates. And then they had like grassroots meetings and going around. It was super important. And one of the drives for Florida was to go around and get legislators, like city commissioners, county commissioners, mayors, to recognize CRNA days, CRNA week, and they got proclamations from, I want to say it was over, don't quote me, but I think it was over like 50 counties and cities in Florida recognized the CRNA week. So that was kind of leading
Wow.
up to that, to get like that widespread recognition. But then once we got there, we actually had it was like a rundown meeting. Like Mackenzie could probably talk about that. Like it was this like overwhelming amount of information. They sent us a video before to like watch before, and then they went through all of that again. It was overwhelming, the amount of information, but they made you feel comfortable. They were like, you're going to walk into these people's offices and you're going to realize that they are humans. And like, this is not some political fight like Mackenzie was talking about. Like, you're going into these people's offices and having a conversation, like you're just having coffee. Like I was very intimidated at first, but when you get through that first meeting, you're like, oh, wow, this isn't bad. Like, I'm just having a conversation. But I feel like Florida they did a really good job preparing. Shout out to the lobbyists that help us out. Samantha, she's a star.
She's great. She's great. Yeah, and to Levi's point about it being a conversation, I remember one CRNA, he was sharing that he was a constituent in a certain area, and he was speaking with that senator, and the senator had helped pass a bill or get a bill through for something that affected his child's middle school education. And so he knew that connection. And as soon as he went to his office, he just started out with, hey, you know what? Thank you for doing that. Like, that's positively impacted my kid in school. And so then whenever the conversation of CRNA advocacy got brought up, there was already a common ground that had been met. And he said that the senator was much more open to hear his points and everything. So.
Oh, that's really neat. Yeah, like you said, it's those little moments that can make a big difference that I think. So, well, I guess kind of now everybody's kind of started talking about some of the meetings that they were involved with. Can you maybe speak to what themes kind of kept coming up in these meetings? Because I think that's important for folks that are thinking about maybe attending Lobby Day or Capitol Day or anything in their own state. What are potentially the themes that they should be prepared to discuss?
I can go first. The In Florida, it was obviously all the bills that we have on the House floor currently. They were making it through the committees at this point, and they were going on to the House floor, which in the past few years, we've had a lot of things passed through our House of Representatives to make it to the House floor. And so that's a big advocacy point to keep that momentum going for Florida and keeping these representatives informed. And so always there's a CRNA like autonomy bill that was House Bill 375, and that recognized removing physician supervision from our protocols. Right now in the state of Florida, any surgeon, or, and I could be wrong saying this word for word, but they can sign our anesthesia records. So you've got a dentist, or you've got a orthosurgeon or plastics that are signing the records that anesthesia providers are doing, even though they don't know at the level of expertise as we do, but they still have to sign our protocol. And so like that's one of the biggest points that we are trying to get across is like we are already providing this level of care at our full scope of practice. We're not asking for more of a scope. And that was one of the biggest things that came up in all of the meetings. Is this a scope bill? Are you guys trying to press your scope? It's like, no, we're trying to stay within the scope that we're trained at and access that full ability of our scope. And without that physician requirement where we have to just have that signature where they just come in and sign, or they're signing a protocol and not even at the facility. So that was one of the big main themes that came up in our meetings that we went to.
One thing that one of the CRNAs in the meeting I was in was saying, she said, we're not trying to replace anyone. We're not trying to come in and push medical anesthesiologists out of the way. We are a solution to filling the gap in Florida specifically because there is such a shortage of anesthesia providers. And she said, we are equipped and ready to fill that gap. We're asking to be able to do that. I could see it on the person's face, like that hit home. So that was really neat.
Yeah, I feel like the scope of practice is always, without a doubt, going to be, a conversation that kind of takes place. There's bills, obviously, again, we've kind of discussed maybe even in previous episodes, like, how when we were applying to CRNA school, just understanding what our scope of practice would be if we were to get into a school in a specific state. So I think no matter what, knowing what you're kind of fighting for there is really important.
Like you said, that's always a topic that kind of comes up is CRNAs have like full practice authority in 27 states, including DC. And fortunately, Arizona is one of them, but it also kind of depends on where you work. Depending on the facility, they have different models of care. And then hopefully, the goal is as we keep showing up to these lobby days or capital days, that we see it increase from 27 states to more. And a lot of people don't realize too is that can also change. It's easily reversible in some states where CRNAs can lose their autonomy. And so continuing to show up and continuing to speak to their expertise is really important. And then even down here in Arizona, the big thing they're talking about now is reimbursement. So you might have heard that United Healthcare is decreasing what CRNAs can get reimbursed, which is 15% less than a physician anesthesiologist. And what the CRNAs in Arizona are pushing for is that CRNAs get paid for the same amount of work that physician anesthesiologists do. So there's not any discrimination in their practice.
One thing that we noticed in all of our meetings and what they were really heavily pushing is FANA actually sent out a survey within the last year, and it said that 48% of students training in Florida. Now, remember, there's 9 schools in Florida. The state is pouring money into these anesthesia educators. 48% of those students do not plan to stay in the state of Florida, and it's likely due to these autonomy bills.
That is wild.
The last 5 years, 1 in 3 Florida graduates leave the state of Florida.
Wow. That right there just drives the point home as to like why advocacy matters so much.
Yes, we had beautiful brochures that said that out there. It had, I know that we said 27 states have full practice authority, but I think the supervision is 44 states, because that was the big thing on one of our brochures. Was it had a map of the United States, and Florida is just sitting there in pink while everybody else is in, I think it was yellow or green. Mm-hmm. And it was like, why are we one of the last states to join this?
Like Florida cannot be left behind.
Right.
And what I think is cool that you brought up is, well, not necessarily brought up, but even if you're going to a school where you don't anticipate practicing, still get involved at your state level, because you can take everything you learn there back home when you move. I think you're going to
Absolutely.
learn very good leadership skills and how to get involved within your state level, and then take that back home and kind of help change things wherever you decide to practice.
Yeah, very true.
I had actually gone to a Georgia meeting where I'm from last October. And that wasn't like a lobby day like this was, but some of the things that I learned there definitely carried over to the event in Florida the other week. So I can attest to that firsthand, that it's very advantageous to be involved in both and just in as many opportunities and events that you can be, because you never know what you might learn and you never know who you might meet.
So true. And I guess then, how would you say this experience kind of now changes the way you view advocacy as part of your role, kind of as a CRNA?
It's crazy because I feel like I catch a fever. Now, my wife will give me such a hard time because every time I get involved in something, I'm like full throttle, full force all the way through. I like come home from lobby days. I'm like, I'm going to go get my law degree after CRNA school. But like,
You
it's
sip
kind of
the
like,
Kool-Aid hard.
it's just kind of like you catch like a fever about it and you're like, this is fun. Like this was not as intimidating. Like you go in with like such like a, oh my gosh, I'm going to be talking with these people you voted into office, your county, your state voted into office. They work for you at this point. Like they're here to hear what you are as a constituent, and they want to listen to you as a student as well. So it was nice to be sitting there with people that actually do change laws and you're talking to them. So it made me excited for advocacy.
Yeah, me too. I think one thing that I was told is that if you are not at the table, you are on the menu.
Yep.
And I think it
Oh,
is
I love
important to
that.
show up to these things, because you don't want people that don't know what you're doing or that aren't educated about what you do making decisions for your profession. And for me, it did like, just like Levi, it gave me that fire to want to get more involved and continue like advocating for the profession, because we wouldn't be where we're at without the people that came before us. I don't think people realize a lot of the work people do, it's all volunteer work. Like people are taking their own time, they're not getting paid. And it just really showed me how much people really care about this profession.
Yeah. It's really not that as hard as I thought it was going to be. I went in thinking that this was going to be a hard thing, but you are the one in the room that knows the most about anesthesia. These representatives, these senators have no idea. You're the expert in your field, and you're the one that's there every day in these ORs, seeing these patients and seeing what happens on a day-to-day basis. They have no idea. Some of these senators, and I mean all of them, I don't even know if there's a CRNA. Is there a CRNA in advocacy or any legislator? That'd
I
be
want to
cool.
be the first one.
Yeah, there you go.
I caught the
But
bug
like,
too.
but they have no clue what anesthesia, what a CRNA is. Some of them want you to explain like what is a CRNA? What do you mean you're in school full time and you don't work while you're in school? Like they don't understand. Why are you calling yourself a residency? Didn't you just say you came from nursing school? Like they have no basis of education except for what is fed to them. And there's other lobbying teams that could be on the other side of things with different opinions that are also sitting in these people's offices and seeing your bills passed.
Our meeting started out intentionally. The CRNA asked the legislator, so do you know what a CRNA does? And the response was, well, you do everything the anesthesiologist does, but you're not a doctor. And the CRNA was like, well, like, okay, like he's like, we can start there. We can start there. And it was kind of a joke and like continued on from there. But that totally opened the doors to like, hey, but this is what we are, with that. And that was really, really neat. And I definitely learned you don't need to be an expert. You just need to be willing to show up. I went into this, guys, just totally candid. Didn't know how a bill became a law. None of it.
What? You didn't never watch Schoolhouse Rock with the
My
bill?
school
Like, come
cheated
on.
us. My school, my parents, I guess. I had been
Government,
living under a rock.
economics, you didn't have to take that
I
stuff?
knew like House and Senate and I watched some like political shows. That was it. Like, did not know. I was a person that was very nervous about this. And I can truly say, like, if you're a listener and if you feel like, oh, there's no way I can go to this, oh, I'm just a student, or I want to keep my hands out of this, like, please don't. Like, give it a try. Please go. It's so worth it. You're going to feel supported. You're going to feel overwhelmed, but it's going to be really, really exciting and you'll learn so much. So
Yeah, all those were great points. But Nicolas, that quote you said, if you're not at the table, you're on the menu. I think that like really rings true. And I think there kind of is this mentality, and I may even be guilty of it at points myself. I think, people get so caught up in what they're doing. And so they always kind of pass the buck in the sense that, oh, someone else is fighting that cause for me. So I think what worries you guys the most with SRNAs, CRNAs, just kind of across the board if people become disengaged?
I think what worries me is a lot because even after Capital Day, I just had some SRNAs and RNs ask me like, "Is this really making a difference?" Like, I just want people to know it really does. Like, I am one of the student representatives for my school, and so I know a little bit more of what's happening behind the scenes than they do. And I'm just here to say it 100% makes a difference. Even just having that community show up, it is powerful. And like I said, it does make a difference when these representatives and legislators see their constituents like advocating for something that's important to them.
Yeah. If we weren't there during lobby days, now that we've gotten past the lobby days and they've actually seen our bills, all of the bills that we were going for and trying to lobby for with these senators and, well, not the senators, but the House of Representatives, they all passed. They passed the House floor just last week. So we are through the House.
Wow.
It's cleared the House in Florida and it's going to go to the Senate, where we have some people that are definitely for opposing the bills or just not getting them seen on the Senate floor. So those are the people that you really have to like lobby with and have those harder conversations. They're a little bit more awkward. Like my first couple of meetings were great. Like on the app that Florida uses. I'm giving away all the secrets. The app that they use, like it had like which direction these senators and representatives have voted in the past when it comes to CRNA bills. It had yes, no, all the way down in support. And so you knew what kind of meeting you were walking into. And my first ones were all lean support of CRNAs. And so those were the easier meetings. And then it got to the lean no's, which was actually, I'm a constituent for the senator. So I was in one of her meetings and she's actually more of a harder no. It wasn't intimidating as I thought. Like I was going in like, oh my gosh, this is a hard no. I was sitting at lunch talking to some of the people there and I was just so nervous that they were going to be like, no, I don't want to hear anything. No, they'll sit there and listen to you and they have questions and they want to hear from you as a constituent. But you just kind of pivot to more of a, okay, we've been here. This is what we've been lobbying for. Our bills. But we also are advocating for surgical smoke in the ORs, and that helps everyone. The evacuation of surgical smoke is a health risk for anybody that's in the OR. Like you don't want to be sitting there breathing in somebody's cautery and like the Bovies being used and you're just like you smell it, you're breathing that in. And so like that needs to be evacuated. So there needs to be bills. So you can pivot to things like that. Or one thing in Florida, another bill that was passed was a title bill. For the past, like I think it was 4 or 5 years, everything's been like nurses cannot say this. Nurses cannot claim doctor. They cannot claim this. They cannot. So we had a representative that actually put a bill on the floor that flipped it to more of a, well, they can say this. This is more of a yes bill. And so that passed with no opposition. It was literally like, I don't know how many people, but it was that to 0 in the House. And it passed just for nurses to be able to claim, I'm a doctorally prepared nurse, practitioner, CRNA.
Yeah, some sort of common ground almost. Nice. All right. So what would you say to an SRNA who thinks advocacy is intimidating or just simply not for them? What would you say to kind of folks out there that maybe are kind of on the border, kind of teetering, but are feeling a little overwhelmed by the thought of it?
I think the first and easiest step is becoming a member of the AANA. So when you are becoming a member, a percentage of what you pay for your membership goes directly to your state that you're registered. And so even then, you're helping fund the state level just by becoming an AANA member. And then it's very easy to you don't even have to speak, just kind of join a committee at your state level or just look up what's going on or even donating to your political action committee because it takes a lot of work from these people and it does cost a lot of money. So anything you can do, contributing like $10, it all benefits them. So without physically being involved, you can kind of help that way, just easily becoming an AANA member.
piggyback off the last question that you asked about becoming disengaged, there was a CRNA that was a constituent in my area, and she met with the same senator as I did. And she said that she got out of school and was like, this isn't for me. Like school, it was a requirement to go to a lobby day and some advocacy events, but it's really not for me. And she did become disengaged and intimidated by the process. But then she went out and practiced. And she said, now I've been practicing for 3 or 4 years and I understand, like, oh my gosh, I should have been at the Capitol this whole time. I should have been advocating for our profession because, like Nicolas said, if you're not there at the table, you're on the menu. And that's that word for word what she told me sitting there in front of that senator's office. So it's very important not to become disengaged and think like the whole thought process of it's not for me. Well, it is kind of for you. It's for your future. It's for the future healthcare of patients. And
it's for your profession, like
Right.
bottom
Right.
line.
Yep.
Right.
This affects where you can work, how independently you can practice, your job satisfaction, your professional respect, your pay negotiation and leverage. It goes a lot further than what we see on the surface, especially as residents.
And even taking it a step farther, like all those things affect your family. Being able to advocate for those things so you can provide for your family is even more important.
When you ask what worries you the most about people saying it's not for them and being disengaged, it's exactly that. That's what worries me, that there's no engagement and that it's not for you. Like that,
Yeah.
That's what worries me.
Yeah, absolutely. So I was going to say, for kind of our last little roundup here, what would be your just like one piece of advice, or what is something that you wish you knew ahead of time going into kind of these days, lobby days, Capitol days, that you can kind of impart wisdom on to those people that are, again, maybe hopefully going to partake in the future?
Yeah, it's not intimidating. Just go. At least go see the action of it. It's pretty cool. You're seeing history be made. I just feel like just be engaged and be involved. Just go see it at least one time. Don't be intimidated.
Just to add on to that is you can, even showing up, you don't even need to speak, but your presence matters, and your presence is very important. Even if you're not speaking to anyone, like there's just power within the numbers of everyone that shows up.
I would definitely say that the scope of practice you are going to graduate into is being decided right now. And you have an opportunity to make a difference with that.
Yeah, that I think is really important, because I think it's really easy to say, well, that's something I'll think about in the future. But like you said, something we need to start discussing now. Actually, that leads us to our next big thing here. So kind of as we wrap up this episode, I do think it's important to mention a recent email that was actually sent out by the AANA regarding the One Big Beautiful Bill. So this legislation includes proposed federal student loan caps that could significantly impact SRNAs. I know it would truly actually impact myself.
Absolutely.
By limiting access to the funding that so many rely on to complete nurse anesthesia programs. So I think this is just a clear reminder that advocacy isn't abstract. It directly affects our education, our future workforce, and honestly, ultimately, patient access to care. So this is exactly why showing up, staying informed, and using your voice matters. So this is a call to action. We're asking those that are listening to take action by March 2nd and respond to the Department of Education by providing an individualized comment, kind of explaining your education, training, and role as an independent CRNA provider. As always, we want to say thank you for joining us for another exciting episode. And for those who don't know, we have an Instagram you can follow at Grade 1 View Podcast, where we share episode updates and behind the scene moments. And if you have an episode idea or think there is some sort of important topic that we need to be focusing on or discussing, please reach out. So be sure to give us a follow. Stay connected. And as always, thanks for listening. We'll see you next time.